But I just wanted to take a minute again to thank Representative Wild and the Pennsylvania Healthcare Association for joining us for this roundtable discussion. We really appreciate your partnership in helping to make sure we protect our seniors and the staff at our long-term care facilities. This topic is just one part of the broader conversation about protecting our seniors in skilled nursing facilities, congregate, and other long-term care settings. Making sure workforce is in place and that the facilities have the tools they need to continue to care for seniors is an objective we all share. At least 25% of the deaths due to COVID-19 have been residents at these facilities, which underscores how important it is to protect this population as we roll out vaccines and continue to recover from the devastating effects of the last year. The COVID-19 pandemic has changed so much about how we deliver healthcare in our congregate settings. We must do everything we can to protect the vulnerable, and that includes shoring up the workforce pipeline for those essential healthcare workers who care for residents in these facilities. Without the service of the over 4,000 temporary nurses aides or TNAs who have joined the workforce in Pennsylvania since COVID-19 began, the negative effects of this pandemic would have been even greater. Their service during this incredible time of need has provided better care for our seniors while lessening the burden for our frontline healthcare workers. That's why I've joined with my colleague, Representative Wild, introducing the Nurses Care Act, which builds on the Section 1135 waivers that the Centers for Medicaid and Medicare Services has implemented, allowing facilities some flexibility in how they hire and certify temporary nurses aides who began working during the COVID-19 pandemic. The bill would give states more authority to evaluate how best to handle their nurse aide workforce, transition TNAs to CNAs, and give facilities necessary tools to streamline their pandemic workforce into a post-pandemic workforce. We owe our nurses aides and other healthcare workers so much, and this bill is a step in the right direction. Now that certain Section 1135 flexibilities are beginning to phase out, it's imperative to get our bill considered and signed into law. While CMS has correctly maintained the nurse aid waiver, we are beginning to transition to a post-COVID-19 environment. While working in private industry, I saw firsthand that on-the-job experience is such a valuable part of improving workforce readiness. Having job experience contribute towards certification, especially during this unprecedented pandemic, is a worthy goal that I think provides those who care for our seniors with a runway toward a more highly qualified workforce. Thank you, and I'm very much looking forward to today's discussion. And with that, I will yield to my distinguished colleague, Representative Susan Wild.
Thank you so much, Rep. Keller. I really appreciate it. And I'm really happy to be joining all of you today for this conversation. I'm a big believer that the best kind of bill is a bipartisan bill. And this certainly is one, and it's got such a great purpose and intent. I'm sure everybody on this call will agree with that. That I just think that it's something we should be talking about a lot. The Nurses Care Act that Rep. Keller and I are leading, it's not just common sense, it's really very timely given the challenges of the last year. And I am really proud to be working with him to help enact this meaningful legislation. This bipartisan bill seeks to ensure long-term care and senior living facilities can maintain adequate staffing levels by allowing temporary nurses aides, TNAs, to retain their certification status after the COVID-19 emergency declaration has been lifted, which hopefully will be sooner rather than later. This reform makes sense because, as we know, the last thing we need to do is further reduce staffing levels at long-term care facilities and at senior living homes at a time when they need resources more than ever. I hear it throughout my district. I know that Rep. Keller does as well, and district and representatives across the country have commented on this as well. In response to COVID-19, as all of you know, CMS issued Section 1135 waivers to provide states with greater flexibility to direct personnel and resources to patients in need. And that was life-saving, literally, for patients as well as for these facilities. And by the way, it was also tremendous comfort to the relatives of patients and residents of such facilities. And so while this regulatory flexibility has been an essential tool in preventing critical healthcare shortages by employing TNAs to offer care during the pandemic, it's set to expire when the National Emergency Declaration is lifted. The Nurses Care Act would ensure that competent TNAs can retain their certification even when the National Emergency Declaration ends, so that the vulnerable populations that they are serving can continue to receive the care and assistance they deserve. I'm really happy that at the state level, Pennsylvania is starting to implement similar changes to what we call for in this bill. But the bill is desperately needed to ensure that TNAs across the country can continue their vital work. Throughout this entire pandemic, so many have selflessly joined the front lines in our nursing homes and long-term care facilities to get our most vulnerable through this crisis. And they also deserve that their work and on-the-job training be fully recognized. We have to ensure that those who answered the call in this emergency have a pathway for full-time employment once this pandemic ends. And with that, I am going to yield back. I'm just happy to be part of this conversation today. Thank you.
Thanks, Susan. I guess what I'd like to do is just sort of open up discussion, and I think Zach's still on the phone with us, and I'm not sure who to look to next, but we'll start with Zach and see if there's anything, any comments, anything that you see that would be helpful for us to be next steps. But again, it's going to be an informal discussion of what we see, and actually, Susan mentioned that Pennsylvania actually took some steps to do this. We just want to make sure that the federal government allows the states to do that moving forward, and we think that the states can best see what they need to do to allow the workforce to get the necessary training skills they need. So with that, if Zach, if you're still on the thing, I know there's a lot of people that have joined us, but if you have anything to add, then we'll just sort of open up the dialogue.
Oddly, it looks like we lost Zach, Tim, and Pete. I wonder if there was an internet outage in Harrisburg. I don't know if they're still on or not.
I know sometimes we have them here in the Capitol, and I'm glad it's working for me and Susan. But I guess if anybody else, Brian, if you want to kick it off there from the,
sure, I'd be happy to. So first of all, let me just say it's a pleasure to. I'm a government relations guy and a guy. I handle ProMedica Senior Care's government relations coast to coast. We're the largest not-for-profit skilled nursing provider in the country, based out of Toledo, but we are one of the largest providers of skilled nursing care in Pennsylvania. And so I have to say it's a pleasure to work with a Democrat and a Republican on the same issue. We haven't done this in years. You guys know as well as I do. It's really fun to work with a Democrat and a Republican who has the Gipper over his shoulder. So thanks so much for being able to find some common ground and push toward just absolute common sense solutions. It's so crucial.
And keep looking to Rep Keller and me for this kind of bipartisan initiative. Please.
Yeah, absolutely. Absolutely. If I could just jump in there, Representative Wild has been great to work with on issues. And anybody that knows me, I know Bob Garrett's on here, and Zach's worked with me in Harrisburg. We're about making sure, and I know Rep Wild's office the same way, making sure we provide solutions that allow our constituents, to take care of themselves, take care of their families, take care of the community, and the people we all live with. So I just want
that we could do that in 433 other districts. So thanks for your leadership there. I did just get a text message from Zach that said the power is out at the office. So I'll do my best Zach Schamberg impersonation, but he does it much more smoothly than I do. I thought maybe it makes sense to sort of take off and sort of lay groundwork on staffing from sort of a funding and a resources level. Congresswoman Wild, I know you mentioned, ongoing funding and resources, and you hear it in your district. And of course, we hear it everywhere because it is such a crucial piece. I mean, we look at decades of chronic underfunding, the responsibility of state legislators, of governors, of people in your chairs who came before you, of presidents, HHS secretaries, you name it, across the board. We as a sector have been underfunded for decades. MedPAC, who has never traditionally been a traditional friend of ours in the skilled nursing space, even they say that our all-in margins are under 0.5%. That is based on data that is pre-COVID. So that is before COVID ever hit the shores of America. We have all-in margins that are underwater. So it really gets down to resources and what we can invest into our workforce. These are people who don't just deserve a minimum wage or a living wage. These folks at times could earn $250 an hour, the same way that we talk about teachers and firefighters and police in this country. They do the greatest work. When I have an opportunity to speak to nurse aides, CNAs, RNs, and others, I say, you are the next greatest generation, to use Tom Brokraw's phrase. But it's important that we understand how underfunded this industry has been. Typically, there is this beautiful symbiosis between Medicaid and Medicare and private pay sources, whereby we may squeak out a little bit of a profit on Medicare, but Medicaid, we all lose our hat. Unfortunately, we care for the vast majority of Medicaid residents in this country, and that is the vast majority of our business. Those are the residents who need the most care, sometimes the most complex, and without that social and family support that you might expect from the community. So it's just one of those crucial things that we need to find ways to address. Look, we may be approaching a generational opportunity here with what we may see coming through with some of the funding packages this year. I have to say, unfortunately, we were left out of any stimulus effort that just passed earlier this year. We've probably seen upwards of $3 or $4 trillion worth of things that have come through to help us in COVID recovery, and skilled nursing facilities and therefore our workforce have been left out so far. So it's a huge disappointment, but we do see some hopeful, optimistic, very different race, optimistic possibilities coming down the way. So we really do hope to sort of get our knees in front of that. And efforts like yours absolutely help us move down the right path, gets us down to first base when we need to find a way to steal a few more bases and get home. So we can't thank you enough for that. That's sort of maybe a national perspective. The same holds true in Pennsylvania, vastly underfunded in the Medicaid program in Pennsylvania. I think we've seen our 7th or 8th consecutive state budget, for instance, without an increase to skilled nursing facilities. It's a very challenging environment, but if it's okay, I'd like to turn it over to my colleague at ProMedica Senior Care, Luke Pyle, who has responsibility up and down the East Coast. Congressman Wild, I think he is your actual constituent, which is fantastic as well. Luke, can you give sort of a Pennsylvania perspective to the resources piece? I think you're on mute, buddy.
He's saying the 412 line is mute, or is Luke muted?
Muted. Is there any way to unmute Luke?
Brian, if while Luke is working on that, I can share a little bit more about the assisted living and independent living aspect of it as well.
Sure.
I think that, and thank you so much, Congress. Now everyone's muted. Can you hear me?
Yes.
Okay, sorry. I just wanted to say thank you so much, and to reiterate what Brian said, it's so refreshing to have congressmen and women from across the aisle reaching to really get things done, especially for an aging state like Pennsylvania. So my name is Meredith. I'm the Chief Operating Officer for Country Meadows Retirement Communities. The majority of our portfolio is in Pennsylvania. We have a little bit over 3,000 beds across the state of Pennsylvania between the two companies that are owned by the family of former Governor George Leader. And I'm proud to represent the 3rd generation of family that owns and operates that business. Our portfolio is mostly independent assisted living and memory care beds with a small skilled nursing facility in Bethlehem. And I just want to really take a moment to emphasize the fact that, you know, Brian said there's been a lot of overlooking our sector because of the thought that Medicare and Medicaid rates can be raised in order to make up for some of the loss in income and rise in expenses. But I just want to be absolutely clear that independent living, assisted living, personal care is completely and 100% private pay in the state of Pennsylvania. So we receive absolutely zero government funding. Our margins hover around 10% in a good year. And the only way we can raise our revenue is by raising the private pay rate that we ask of our senior residents. So just going to say that again, absolutely zero government funding. We have not been eligible for the PPP loans because we're too large. We have not been able to garner that much of the CARES Act funding to make up for even our expenses that we've invested in. And as Brian said, you know, the shrinking workforce has caused intense competition in the state of Pennsylvania. And we have seen the majority of our younger female of a childbearing age or school age children age leave the workforce in the last year because of challenges with school, because of challenges with childcare. And, you know, we continue to have to pay higher and higher rates without the ability to raise our revenue to stay in business. So that is sort of the other side of things that I'm not sure there's been any focus on is the assisted living support, where, you know, I sit in an office where I can see the Penn State Hershey Medical Center out of my one window, and I can see our Hershey campus out of the other. And I can tell you that I was watching the numbers go up in the spring, and we had more cases within our Hershey campus than the entire Penn State health system as a whole at most given times. And yet, as soon as we would send our residents over there, they would say, there's no treatment, there's nothing we can do for them. We're sending them back to you. And by the way, we're not sharing any tests or PPE. It's sort of on you to figure it out. Same thing with the Department of Health. So we've had very limited resources. We've been hit quite hard. We are continuing to do the right thing and invest in whatever needs to be invested in to keep afloat. But, you know, it was a frightening time over the last year. And there were times that we didn't know if we would be able to continue as a business. And in a state that's as aging as Pennsylvania, I don't think you can afford to lose this infrastructure that is essentially supporting some of the hospital and the healthcare efforts.
Luke, were you able to unmute or no? I think there's a system issue going on. I don't think that's on your end.
Can you hear me? Can you hear me?
There we are.
There we go.
Welcome, Luke.
Okay, I'll do my best now. Thanks. We appreciate your time, number one. So I'm Luke Pyle. I live right outside of Allentown, Pennsylvania, in Warfield. I operate 42 skilled nursing and rehab centers in the state as part of ProMedica Health System, a not-for-profit health system based out of Toledo, Ohio. I've been with our organization 18 years, and I've been a resident of Pennsylvania my entire life. And I wish I could have heard Meredith's update because I suspect it might be the same, but we'll see. You guys can grade it. My comments or lenses are as an operator. So while I think we are turning the corner on COVID-19, I don't think we can declare victory in post-acute by any means. Quite frankly, I think the wreckage left from the pandemic puts us in actually a worse position than in 2020. So I prepared some actual statistics of this reality. So my patient volume is down about 15 to 20% in my locations in Pennsylvania. You would think you would need less healthcare workers to provide for those individuals. The reality is much worse. I have less employees than ever before. The number I had today, I have about 1,500 jobs posted across the state that I'm actually trying to fill. My assumption is it's a combination of stimulus, unemployment, wage competition, limited child care, and really a general fear of working in healthcare setting during a pandemic stunts our applicant flow. So a couple of things we've done and just some of our realities we face to fill those open positions in the first 90 days of 2021, I've raised wages across the board in 29 of my 42 locations to recruit new talent. Just bringing my internal staff that have stuck it out through that's a $3.2 million cost before we hire a single employee. Until those wages make a difference, we have to call outside agencies to fill our open nursing positions at a very, very high premium cost. So some of those numbers in 2020, we spent over $32 million with those staffing agencies. Unfortunately, in 2021, it's actually worse. My annualized spend for 2021 is $66 million of agency spend. Some of the other costs that I associate that really I think some might think are done really haven't even peaked yet. So when our staff has turned positive as part of our organization, we've paid them for their time off, regardless of where they got COVID-19. That cost us about $5 million just in Q1. That was another $1 million. Vaccine hesitancy is a real thing. We as an organization have an incentive program to pay individuals to help encourage them to get the vaccine. We've spent over $3 million just in Pennsylvania on that. That bonus still exists, and we will have more access. But unfortunately, our nation is pretty polarized on the vaccine. Finally, testing. So as community spread continues to increase, Lehigh, Northampton counties are examples where our testing is back to twice a week as our regulatory mandate. Testing for Pennsylvania for my organization was almost $15 million. For Q1, our projected spend now is $36 million to continue to test employees and patients in our state. So I don't have a solution. We're not giving up. We're going to continue to fight. But the reality, I think, a common question would be, how do you pay for all this? And really, we're not self-sustaining right now. For my Pennsylvania portion of my operation, which is almost half of the 8 states that I cover, my operating income for Q1 is a negative, not to budget, is a negative cash flow of $24 million. So I appreciate the time from both of you. I do think the Nurse Care Act is a great step in the right direction. But this is, in my 18 years in this industry, I have never faced anything like this, and any solution is a good one right now. So that's what I had, Brian.
All right, I think we should all stop saying negative things about Zach Schamberg because I believe he's back. Thank you, dear leader, for coming back and helping.
First of all, I apologize, everyone. We say that PHCA is always here for our members, except in the event of a power outage. Then everybody's on their own. And that's what we had here in Harrisburg. So I apologize. We are back. Brian, do you want to tell me where we are in the agenda?
I was just about to throw it over to Debbie to talk specifically about this bipartisan piece of legislation that the Congresswoman Wild and Congressman Keller had introduced for us.
Yeah, please do. Please do.
My name is Debbie Rowe. I'm the Vice President of Nursing Workforce Development at Genesis. We are also a long-term and post-acute provider. We are nationwide, so we're in over 25 states, and we have over almost 50,000 employees. And I wanted to go ahead and really emphasize my support in regards to the Nurse Cares Act, because I was responsible with a team to go ahead and launch the temporary nurse aides in Genesis. So we did hire over 600. We currently still have 319 still working. There's almost 60 in the state of Pennsylvania. And I am a registered nurse, and I'm responsible in our company for nurse aid training and other modes of training for nurse aides. And I really do want to emphasize there's 133,000 people that took that ACA online temporary nurse aid. And I do really want to support an opportunity for a pathway. And what is recognized in that Nurse Cares Act that I thought was very clear, and also with the legislation in Pennsylvania, is that it not only emphasized their on-the-job training and their introduction to long-term care, but there was a skills competency component to it. And it also recognized that there is still a standard of education required. So I really wanted to put my whole heart support behind that. And particularly, in the past year, there are many states that did not have the ability. And I have to say, Pennsylvania was included with a number of states countrywide that could not offer the state testing. And to have that component recognized in terms of that state testing for nurse aid certification was really crucial, because when you think about it, the temporary nurse aides, for their pathway to go into certification it could cost in the state of Pennsylvania up to $1,700 per person to go in a nurse aid training program, as well as $135 for the state testing. So if there's any questions related to that, I'm very, very supportive. And I think it's a great introduction, and it's a recognition of those that care and compassion to our patients and residents. And I really want to share, my mother is in memory care, and if it wouldn't have been those care providers, when I couldn't see her, I'm waving through Zoom and talking through barriers, but they made such a difference. So for those that are committed, I really appreciate the opportunity for that bridge. You know, so I did want to make that one point in regards to the CARES Act. The second area I wanted to emphasize is I thought there was a wonderful opportunity in nurse aid training to recognize that the number of people that took that online program is significant, because I think there's an opportunity, particularly in Pennsylvania, to recognize that blended, and the association has been very diligent in promoting it. It does not compromise the state regulatory body hours required for nurse aid training. In fact, it actually offers another avenue and a pipeline for us to really attract those workers into our industry, because it allows a level of flexibility. It allows those people that are working, you know, we had situations where moms after 11 o'clock at night were logging on to blended online. And Genesis has been involved with blended education with nurse aid training. It is approved in a number of states across the country. And we've actually had 300 graduates of that blended. So we do over 500 in this pandemic. We did 500 nurse aid training programs across the country that included blended and offered over 2,500 graduates. So during the pandemic, we were training. So I really wanted to emphasize that opportunity for blended. It really recognizes, you know, the standards. It also includes the clinical as well as the lab and those hour components at the center. So it's not compromised. The bottom line is all the classroom, the didactic area was allowed on a platform that could be accessible 24/7. So I think it represented another avenue for people to be attracted in terms of training. So I did want to emphasize that. And there was a bipartisan bill. I did want to make that third part, you know, to really promote. There was a bipartisan bill that was introduced, and we did a lot of work on that. That was introduced, actually, Representative Dwight Evans introduced that, and that was the Nursing Home Workforce Quality Act. It was also Representative Ron Estes. He was also a co-sponsor in regards to that bill. Unfortunately, with the pandemic, there were other priorities, but basically what it allowed is that when a center has a substandard survey that they receive, that they have, depending on if they have a certain level of that restriction, that basically what happens is they have a 2-year moratorium in terms of doing nurse aid training at their center. And it not only prohibits them to do training for 2 years, but it also prohibits them from having clinical nurse aid students from surrounding technical schools, community colleges, etc. And the thing is, the way that the bill was designed, it recognized that there was a substandard. They have to remedy that, you know, within 2 years. You know, that there is still a component of oversight, but it allows them to do training. And I think that is a really important part. So we wanted to go ahead and reference that as support. So I wanted to make those 3 points to you. I know there's another part with medication aid, but I'll go ahead and defer to Zach. I know there's a number of people that wanted to speak.
Thanks, Debbie. You know, I think what you heard in that legislative overview, and I think the credit goes to folks in Congress, our legislators here in Harrisburg and throughout the country. We've had to get creative when it comes to our workforce. The temporary nurse aid program is a fantastic example of thinking outside the box and figuring out ways of how to build this workforce pipeline. Once again, Representative Evans's bill is another example. You know, we've talked about the ideas of employing med techs or making permanent the temporary nurse aid program. I think we're going to have to do that more and more throughout the next few years, rather than attempting to fit a square peg into a round hole. Let's think outside the box, and let's find ways to get new workers interested in a very rewarding career. So thank you, Debbie. Does anyone else have any thoughts on the legislative initiatives that have been undertaken thus far at the federal level? And if not, Brett, why don't we bring you in, Brett Boyer from Bedrock, on education and what we've done as an industry here in Pennsylvania to try to gear education towards long-term care careers, not just higher education, but maybe even younger Pennsylvanians in high school or middle school.
Thank you, Zach. So good afternoon, everyone. My name is Brett Boyer. I'm the Vice President of HR and Workforce Management at Bedrock Care. We currently have 8 long-term care facilities across the state of Pennsylvania with around 2,000 beds and roughly 1,800 employees. So today I wanted to talk about 3 topics. So the first topic would be the current long-term care staffing needs. The temporary nurse aid program would be the second. And then the third, the need for a career path into long-term care. So I myself have been working in long-term care. I started as a CNA when I was 16. The staff that I worked with is some of the most loving and caring individuals that I've ever worked with. This year, they finally have recognition. You've heard them being called heroes, and they definitely are. But I think there's also some forgotten heroes here. I think the forgotten heroes are the people that we take care of in our buildings. These people are our mothers, our fathers, grandparents, great-grandparents, and so on. They've helped build and mold this nation, so we have opportunities like this to discuss issues. So without question, they should be receiving the absolute best care that we can provide. But in order to do that, we need the staff. So in pre-COVID, nursing homes were already short-staffed, struggling to fill our positions. These increased greatly in the pandemic. Here are some of the contributing factors to the growing need of staff. Fearful of attracting quitting. Fathers are having to stay home with their children because of virtual school and closing childcare centers. Acute care hospitals are increasing their rates. Some nursing staffing agencies are increasing bill rates by almost double of what we used to pay. A lot of long-term care operators have tried to increase rates. But with hospitals and agencies where they're at now with their rates, we no longer can compete. This is why I'm pleading for you guys, and I'm happy to hear that you guys are interested in it. The state implemented that temporary nurse aid waiver. This was a literal lifesaver during the pandemic. We were able to hire fast. CNAs no longer had to pay out of their pocket for training, and they were able to start on-the-job training, getting paid day one. In my company, we hired more than 100 temporary nurse aides. These people have stepped up in the height of the pandemic, and we need to create an easy pathway for temporary nurse aides across the nation to become CNAs. And I believe that we need to keep this program with a few tweaks, but this will help us quickly fill our needs in our communities. And then my last point was just career paths. There's a great need for the development of career paths into long-term care. The temporary nurse aid program has provided us with the first step to provide this career path. I can now offer this free program and present it to schools, VOTECs, colleges, and etc. to get the students interested in working in long-term care. I'm happy to announce that my company, Bedrock Care, we're rolling out a long-term care career path in which we are financing a temporary nurse aid career advancement to become an LPN or an RN if they desire. This also offers schooling opportunities for lower income communities who may not have the means or the funds to pay for college or tech school. But in order to make everything that I just presented successful, we need your support with our ideas, and we need your support with funding and reimbursement rates. Thank you, guys.
Thanks, Brad. Appreciate your input. And I've always loved to hear the great things our members are doing individually and in terms of partnerships again, to get the workforce pipeline flowing. You know, on that point, and the last thing that we wanted to just raise today is, again, to the importance of thinking outside the box, looking at some of those partnerships with local chambers of commerce, with schools, with workforce investment boards, with counties, to try to make this or advertise this career as an attractive career for younger Pennsylvanians moving forward, given our aging demographics, which I hope to talk a little bit about later in our discussion. Given the demographics that we have in Pennsylvania, we know that this is going to be a need. This is a career that will last the next 10 to 20 to 30 years. And we need to ensure that we're advertising and getting the word out to younger Pennsylvanians about that. So employing those local partnerships, bringing in folks and groups that we wouldn't necessarily or normally have brought in before, and utilizing those relationships to build our workforce pipeline. Would anybody like to add anything to that or to the educational side of this?
This is Debbie. I just want to interject and support some of the comments that were previously made in terms of Brent, is that the career pathways are a very crucial part in terms of long-term care. I've been Genesis for over 23 years, and the bottom line is that we really believed in supporting nurse aid training. It's usually an entryway, and just as Brent said, people don't have the opportunity to afford like over $1,800 for a private nurse aid training program. So we started back in 1999. We started small. We've had over 10,000 graduates. And just to emphasize to you that it is a viable career pathway to get an introduction in our business, is because we actually had promotions of over 1,800 people, over 150 nurses, RNs and LPNs, 2 of which are actually nurse practitioners. And we actually had a pathway in terms of the allied health. We had 1 respiratory therapist, as well as other therapy aides. So I really wanted to really leverage off that. And the thing that you said, Zach, also resonated with me on the medication aid, is that all these areas give people confidence that if I got through this training program, it may introduce us to the next certification or stackable certification, and that is the medication aid. There's over 15 states in the country that recognize medication aids. In our New Mexico, we have over 22 centers that are approved for certified medicine aids. But it allows, I think, please recognize that it's usually at least a year or 6 months of experience in most of these programs. There is an additional level of education that includes classroom and skilled medication administration. And the thing is, it allows, we believe, and we found that it gives people the confidence to say, wow, I might really definitely go to be an LPN or RN. So, and it also enables us, because we're dealing with shortages in nursing as well, it allows the nurse to do the other type of assessments, wound care, that in her higher level of her license, but yet it has 1 dedicated or several dedicated staff members that are dedicated toward medication administration. So thank you, Zach, for letting me add that little piece.
Debbie, if I can just reflect on that as well. We already use medication associates in the assisted living setting. And I will reiterate that our medication errors are no higher with that certification than they are with our LPNs who pass medications. And it actually allows our LPNs to round and provide better clinical oversight rather than just be passing medications all the time. So it has been a real benefit in the assisted living environment. And one other trend that I think many of us mentioned, and I know that Representative Keller, you're on the early education committee, and so many of our coworkers are young women, and so many of them are now out of the workforce because paying for childcare is just as expensive as their salary that they make with us. Even as you can see, all of us are committed to raising wages, creating or having already created career paths for continued growth, and taking good care of our coworkers. If we can have some support to get more people back into the workforce, I know that the infrastructure bill has addressed some ideas about early childcare and preschool being supported by the government. And although I know that's quite a liberal agenda item, when you look at the outcomes in Arkansas, where they have had that in place for over a decade, it's increased high school graduation rates, and test scores and allowed more people to get back into the workforce. And that is something that already a majority of our coworkers are relying on social support and services from the government to subsidize their childcare. But if we could really have a well-formatted program to get younger children into school earlier, I think it would both help our educational system and help get more people into the workforce.
Thanks, Meredith. So Representatives Keller and Wild, what questions do you have for us? What, after hearing what you've heard thus far, what comments do you have for us?
I guess I'd just like to say that, one, I appreciate everybody being with us today. Just one thing on the provider relief funds that normally go for, hospitals and so on. We're hoping that will be available, to help nursing facilities, help your organizations in the future. We're hoping that HHS will soon have a ruling on that this year. So that's one issue that we're looking at doing, as far as making sure that people have the resources. Definitely willing to take a look and see what we can do there to help our working families. Whether that's in an infrastructure bill or something different. We can have those discussions on what we need to do there. But I guess I just would say that anything else that you think that we need to continue to build on, and I do understand that the points of the margins that you're working on, the testing, the additional things we're trying to, during the pandemic, I know we were all working to get more resources to healthcare providers, long-term care facilities, in congregate settings. So, looking to continue working on how we can do that and make sure you have the tools you need to do your job. I will just say that, and I think Deborah mentioned it, she was talking about the people, that do the jobs and how they really care for the people that they're with every day. And the personal experience with that is my wife worked for the Commonwealth of Pennsylvania for 35 years in one of the centers, the state-run centers for individuals with intellectual disabilities. And the people that she was with every day were her family. And I know that the job that's done, not just by our LPNs and our nurses and our doctors, but by the CNAs, they do it as a labor of love, and and it's the work that you do. So anything that we can do to be supportive, we want to make sure, and that's why this is so important. I'm actually have taken some notes, but also with me, you can't see him on camera, is our legislative director, Kevin O'Keefe, who has worked on healthcare issues. Prior to being on our team, he was on Congressman Barletta's team. So we have a great resource here in Kevin, and we will just want to make sure that as we move forward, and again, I will say again about Representative Wild, she's been great to work with, and I know really our goals to making sure that you have the tools and your teams have the tools to care for our people in our community that need the care. We're committed to doing it. So with that, I'll yield to Representative Wild.
Thank you so much, Fred. I hearing all of you today, and also particularly thinking about the fact that given everything that we've done in Congress in the last year to help this economy and our country recover, the fact that we haven't done enough for our senior living and nursing home facilities is really dismaying to me. And I feel as though it's reflective, unfortunately, of a general lack of respect for the role of our senior citizens. And I don't think that that's intentional by most people. I think that it's simply that there are so many pressing issues right in front of our faces that we often tend to forget about people who deserve to be highly respected and cared for. So I'd just be really interested to hear, and it doesn't have to be right now, but I'd love for you to continue to send information to Rep. Keller and myself about what kinds of initiatives we can introduce that would be helpful to you, that would, and of course, particularly to your residents and your patients. And what do we need to do more of? You know, it's confounding to me that we haven't done more for this industry. And I hate to call it an industry because I think, but you know, for lack of a better term, I think that's really important. The other thing is, you know, the Nurses Care Act specifically is focused on people who entered this profession during the pandemic. And I'd love to work on some things that help to build the profession of nurses aides, nursing, and the allied health professionals in general, not separate apart from the pandemic. So if you could give that some thought and get it back to us also on that. What can we do? Because I know, listen, we know that everybody is short on workforce right now. Manufacturers, the educational system. I mean, I don't go anywhere in my district without hearing that restaurants, everybody needs more workers. But I consider senior care to be an essential service. You know, and not by any means to diminish the role of restaurants in our society, but you know, we can choose whether or not to go to a restaurant. We can't choose whether or not we need, you know, care as seniors or our family members do. And so I'd really love to think about it and to think outside the box on what we need to do to increase the attractiveness of healthcare, and I don't mean physicians, but allied health professionals as a career. What, you know, and Fred and I are both on the Education and Labor Committee. I think we'd love to take back ideas, especially on a bipartisan basis, for how we can attract more people to the field. What do we need to do? Is the cost of entry too high for them, given the wages that they're paid once they get into it, et cetera? So just, if we could just have an ongoing dialogue, that would be great. And I've got my legislative directors on the line, Erin Megan, and I know that she's taking notes as well while there she is. She just turned her camera on. Erin's my deputy chief and ledge director and knows how much I care about these issues. She also has a really strong background in healthcare, having been with the Ways and Means Committee. So anyway, that's all I have to say, but thanks. This was really great and very thought-provoking.
So I can interject in terms of those career maps. One of the things that we did at Genesis, now it is, you know, it is actually on paper, but it's called Mapping Your Future. And literally it actually gives you a whole career path all the way based on your education, as well as you increase your education and your experience. It goes from, you know, being a dietary aide all the way being to a registered nurse. So we actually did the clinical and non-clinical positions, so that you could actually see, because a lot of times in our nurse aid training classes, it's like, we heard the graduates say, why aren't we getting paid more and recognized? And we said, look, we can offer you these different career paths. So it is literally on paper, but I know like in the state of Iowa, they did a whole career pathways. They have it online in terms of different, you know, positions. It's not necessarily all long-term care, but it's written. But I think there's an opportunity for that, you know, more and more. But I have to tell you, people still like paper, you know, with these maps. And, you know, and it really is starting in those secondary schools and, you know, the grade schools to really promote the education, you know, with different career pathways. Because I did mention I'm a registered nurse, and I'll be honest, in my bachelor's and master's, I did not have any exposure to long-term care until I actually worked at Genesis. You know, and I think we surprised the acute and the home care and the hospice, which is my background, by saying, wow, we have a lot of career opportunities to really recognize that. So thank you.
Great.
Thanks, Debbie. And Representatives Keller and Wild, if you'll just indulge me, because I did want to kick off today with some remarks. And now that I'm back on, you know, I would make it's 2020. I'd make a joke like that, but it's 2021. So I can't really say anything. Things were supposed to be better this year. But I want to thank you on behalf of the providers on this call for taking the time today. It's, you know, I find it that it's been very rare that those in the legislature will come to us seeking solutions. And when that happens, especially in a bipartisan manner like we've seen today, it's very, very welcome. And I think it's safe to say, again, to the providers on today's call, we've got two partners, two supporters in Congress who we can work with moving forward. And I'm very, very excited for that partnership. What I will also say is this, as the president of the Pennsylvania Healthcare Association, we represent all of long-term care in Pennsylvania, nursing homes, personal care, and assisted living. And you've seen that represented on today's call. We represent the providers, we represent the workers, and I think most importantly, we represent those vulnerable residents in Pennsylvania. You've also heard the term healthcare heroes today, and that really has become the apt term for our staff and for the folks who have joined me today, not just in Pennsylvania, but throughout the entire country. And it's important to note that on any given day, even with census down in long-term care, more than 100,000 Pennsylvanians are being served in nursing homes, in personal care, and in assisted living. And while that may seem like a large number today, we are the third oldest state in terms of our population in the entire country. Our fastest growing demographic is age 85 and older, and we are approximately 3 to 5 years away from the silver tsunami, or when the baby boomers are going to age into the demographic most in need of long-term care. So needless to say, we need to ensure that we're going to be able to care for our seniors, not just today, but in the months and the years to come. In my opinion, workforce is the number one issue facing this sector today and moving forward. I think today was a very, very important step in beginning to address that. And we're looking forward to the next steps with you. So thank you very much.
If I could ask a question, just so for my understanding, when we're talking about the settings that we see in when we're in long-term care facilities, would it be a proper assumption to believe that the individuals that are in the long-term care facilities are probably the cases that require more care versus the people that are able to remain at home? So while your population may be declining, say because some people are getting at-home services, that traditionally when I was a kid would have been in a nursing facility, because I was a dietary aide when I was in high school. I actually worked in a nursing home in the kitchen, and you saw some seniors there that were mobile and could do things and so on. But I would think now with the evolution of how we care for our seniors and people being able to get services at home, the population you're serving requires more care, and therefore it might look different today than it did even 10 years ago or so, and it may even look different as we go forward, as we look at policies in how we help you. And I would even say reimbursement rates and so forth, because you're providing a more intense level of care, I guess I would say. Would that be a proper assessment?
Yes. Does anyone want to take that question?
I'll happily jump in. I think that's absolutely right. There's been a long-standing 20-year battle between advocates and nursing homes, with advocates who will say everyone should be taken care of at home. The president's put forth $400 billion in his forthcoming proposal that will help clear the home and community-based wait list in every state, and that's something that absolutely needs to happen. But if you really focus in on those social determinants of health, there will be a handful of residents and a handful of nursing homes who probably could better be taken care of at home if only they had the support there. So maybe they don't have that family support. Maybe it's a housing issue. Maybe it's as simple as a wheelchair ramp. So I think there will be some funding that is probably forthcoming to help in those cases. But I've had the best track record over 15 years of taking advocates through nursing homes and saying, if you find somebody in this building who can be taken care of at home, I'll drive them myself. Let's go pick them out. And when you go up and down the hallways of a traditional nursing home, it is just not the population that has the ability to be taken care of at home. Their sons or daughters do not necessarily have the expertise that it takes. There maybe is not the resources or the ability from a housing standpoint to be able to take care of those folks at home safely. The outcomes are worse. We focus very intently on preventing rehospitalizations, and oftentimes the care that is delivered at home, because it comes in fits and spurts of an hour or two, are not the 24-hour level of care that you get in a nursing home. So I think that your premise is absolutely right. We take care of a very, very acute and sick population. They're our most frail and elderly in the country. And we've got to find a way to do that at high quality, and to do that takes both workforce and resources.
Yeah, I would say that there are some people that can live at home independently or with some help, and we should do that. But I also need, when it comes to caring for individuals, and this was always my position in Harrisburg, because we have the state-run facilities, like I said, that my wife worked in and other people do. There's a need for all levels of care, whether it's home-based, whether it's in a skilled nursing facility, and I think we need to support all of those, and that's what my question came about, because what the reimbursement rate might have looked like years ago might look different per individual because of, well, because I always was dealing with the issue, well, it costs more to care for somebody in one of the state facilities. Well, it did, because they were the more acute case than the person that could be cared for in their home. So I just wanted to make sure that I was looking at that properly, and thank you for that.
You are.
I think the other compounding issue on that is the fact that Medicare payment reform has pushed every piece of care to the lowest cost level. And that is often the skilled nursing facility or the home health, or even for people who can pay privately, our setting assisted living. And so we're saving the Medicare system money. And if you lose those good quality providers in our post-acute sphere, you're going to have more and more people going back into the acute setting for chronic care management. And that's, you need to retain this piece of the infrastructure in order to save money for Medicare as a whole.
Okay.
And this is Debbie. I just really wanted to speak to what you were saying in terms of the patients and residents that we serve. We definitely have seen a different and varying degree of education that's being requested from our nurse aides. We do a career advancement ladder at Genesis, and some of the topics we definitely put in, the care and compassion and wound and elimination and all those areas. But some of the requests that we've had is, dealing with not only the patients and residents and their family and loved ones with addiction recovery. We've also requests for trauma-informed care. They also is a segment of mental health first aid. So we're seeing that more, and that's not just in one particular area, but in multiple, in terms of our centers across the country. So I did want to also recognize that as well.
Okay.
Okay, thank you.
I would say at this point in time, I think on the Nurses Care Act and everything related to that has been answered. And I guess I would just say, Zach, is there anything else that we didn't cover that we should have in this meeting? I would look forward to maybe in the future, as we move forward with ideas, recommend future meetings to build on what we've started here today.
Yeah, I think that's right. I mean, we've covered the 4 pillars, I think, that really address this crisis, the 4 challenges that we need to address, and the solutions, some of the solutions you heard today that ultimately will get caregivers to our most vulnerable residents. So I very much appreciate, again, today's conversation, and I think it's the first step in a longer process. So thank you again.
Thank you. Thanks to everybody.
Thank you all. Thanks, Fred.
Thank you, guys.
Thanks, Susan.
Thank
you, everybody. Look forward to working and building upon this success. Thanks.